Hey, Bulvaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Lavilati. Massive thank you to everyone that have been following our social media pages and especially right here on a brand new YouTube channel. Make sure to hit that subscribe button and like our videos. It'll help us a lot. Thank you very much. Today we've got a very special guest, and you've probably seen him in one of our earlier episodes, ophthalmologist here at Oceania Hospitals, Dr. Posala. Bulvaka, Doc, welcome to the show.
Bula, Alex, and thanks for having me this today.
How are you?
Bula to everybody out here that listening as well. I'm very well, thank you.
Well, we'll just touch base on something that's currently on the social media pages right now, and it's something that needs to be called out, yeah? And that's Pterygium, you know. Let's just dive into that, understanding Pterygium. You know, many people may not be familiar with the term Pterygium. Could you explain in simple terms what it is and how it develops and why it's more common in our region?
All right, thank you, Alex. So Pterygium, basically, like many names of some conditions in medicine, you have fancy spelling and fancy writing. Pterygium has a P in its spelling, but it's actually pronounced with a T. So it's a silent P. And Pterygium can be described as a fleshy growth on the surface of the eye. And there can be many different fleshy growth on the surface of the eye, but this tends to happen more commonly where there's a lot of sunlight. So it's more common in countries that are around the equator, around the globe, where there's a lot of sun. We tend to see more pterygium growth, the fleshy growth on the eye, and in a larger size than those that are seen in, say, less sunny countries. And basically, it's a fleshy growth that starts from the whitish part of the eye, that is our conjunctiva, and it grows, it tends to sort of grow and enlarge over and across towards the cornea, which is sort of the central black part of the eye, all right? So, yes, it is a fleshy growth, and it is not a cancer.
Thank you for clarifying that. It's not a cancer, because I think there's a lot of perception on it being a cancer, and especially with social media nowadays, you know, everyone's just going all out with false information, and you got to be careful with that, ladies and gentlemen, and also to our children who are watching it right now. You know, misinformation, disinformation. This is something that we need to be wary about on the internet. You know, just jumping right into causes and risk factors. You know, we live in a tropical climate, right? And with lots of sun exposure, can you share what are the major risk factors for developing pterygium, and what lifestyle or environment plays a big role? You said sunny countries.
Yes, so basically if we live around the equator, around the globe, equator region around the globe, which has a lot of sun, then one of the main risk factors or causes would be exposure to sunlight. So again, not everyone develop this growth on the surface of the eye, but people who do develop this growth, if you're in warm countries like Fiji or the other Pacific Island countries, the growth tends to enlarge over a number of years, and it can be quite frustrating for people who have it. It can cause watery eyes, it can sometimes be painful, and if it's left alone to get, sort of enlarge and stay for a number of years, it can actually cause a deterioration in vision as well. So it can affect your vision.
Thank you for that. You know, so symptoms and impact. You know, some people might think that pterygium is just a cosmetic issue, but it can actually affect vision. What are some common symptoms patients experience, and at what stage should they seek a medical attention?
Right. So this fleshy growth on the eye, once it starts off as a small defect on the surface of the eye, and usually does not cause much irritation or watery eyes in the early stages. But as it enlarges in size, as I mentioned, it can cause watery eyes, it can cause discomfort and irritation. It feels like something is rubbing when you're blinking in your eyes, and it can also affect your vision. And coming back to your previous question, what can we do to prevent or mitigate against this growth getting out of hand? Well, you can wear polarized sunglasses, covering so that exposure to sun is reduced. We cannot take away the sun. It has to be there. But you can do things that will sort of lessen the exposure of your eyes to sun. Now, coming back to when do we seek medical attention for these issues? It all depends on what this growth is causing your eyes. So for some people, even if the growth is really tiny, it can still cause irritation. So the need to seek medical attention comes back to what symptoms you are feeling. So yes, we don't treat it cosmetically, but even with a smaller size growth, it can cause irritation, it can cause watery eyes, and this is on most days. And people who have this complain a lot. And we treat pterygium in two stages. So the first stage is that we treat with medical management, and that's using eye drops. So that can sort of reduce the inflammation, reduce the symptoms of watery eye, gritty feeling in the eye. So eye drops can do that. But at some point in time, even with eye drops, the blurry vision will start to come in. And if that does happen, then I put the question back to the patient: how bad is it affecting your daily life? How is it disturbing your sort of daily activities? And if it's really affecting the daily activities, then it is time we sit down and discuss the next stage, which is we can do surgery. And it's a simple surgery done under local anesthesia, and it gets rid of this growth from your eyes.
Thank you very much. You've just mentioned prevention. Oceania Hospitals offers treatment, and for this, could you walk us through the treatment options available and what surgery involves, and most importantly, how people can protect their eyes? Like you said, sunglasses. Are there any other forms of prevention, just to prevent them from developing this in the first place?
Yes. So I mentioned the use of sunglasses. So the risk in regards to exposure to sunlight obviously will be different as well for people in the rural who are outside most of the day doing activities in the garden or doing fishing or out on the seas, and people who are working in offices and places like that. So the high risk group are the people who actually their daily activity are out in the field or in the seas like that. So this group of people, if you do have this growth on the eye, it is essential that you wear protective sunglasses. It is essential that you wear sometimes wide-brimmed hats just to lessen the exposure to sunlight. But as I mentioned, even people who work indoors can develop it as well. So once it happens, then we seek medical attention for the symptoms that it's causing. We can start off with the drops. That's the early stages. But later on, when it's really sort of progressed further, then we might discuss surgery for this growth. And surgery, the other thing about it, the importance of removing that growth also is to send it for pathology if we suspect that it is not a pterygium or it might be something else. So yes, that's another indication in which we would start discussion about surgery.
Thank you very much. Well, there you have it, ladies and gentlemen. Just touching base on pterygium and what services that we offer here in Oceania Hospitals. If you've been following our social media pages, especially on Facebook, right here on Facebook, you would see that we have a post up regarding pterygium. And if you think that you have it or you just have questions, feel free to drop us a message, or you can come in for a consultation and you can come and see Dr. Posala. So stay with us, because next week we'll be diving into our dietetics and nutrition team and how important ISO 22018 certification is, and how important it is in terms of providing quality services to you that come on down to Oceania Hospital. So until next week, Vinaka Vakalevu.